A sleep study is a test that's done on someone to evaluate certain parameters that could determine whether or not you have a condition called sleep apnea. In the past, sleep studies were done at a sleep center or a hospital-based sleep lab, but nowadays we have these home sleep tests, which are very accurate and much more convenient. Essentially, you can get a box which you would put on your bedside table, and it has 4 wires that would be going to different parts of your body. One would be something that goes around the chest strap, which would be measuring the excursion in and out of your breathing of your chest. Another would be something that goes on your finger called a pulse oximeter, which would measure your oxygen levels. And then the last 2 are usually together. It's a microphone which is attached to a cannula that will measure the airflow from your nose and your mouth, similar to a nose oxygen cannula that you may or may not have seen on someone who was on oxygen. This test then is run by, you just press start on the box, and when you are finished in the morning and you wake up, you turn it off, and it has an SD card in it, so you can send the whole thing back to the company, and they will then send a reading to your doctor with all the information as to whether or not you have any underlying condition like sleep apnea, or if you just have primary snoring, or if it's normal. Sleep medicine is a very broad category within medicine. It initially started out with pulmonologists, who are lung doctors, evaluating people for sleep disorders, and now it's really a fellowship that you can do as a pulmonologist, but also I believe you can do a fellowship from other specialties like family medicine. In ENT, we don't do sleep fellowship, but we know all about the airway, which is usually the primary site of obstruction in patients with obstructive sleep apnea. That's not the only kind of sleep apnea. There's also central sleep apnea. So the sleep doctors are very capable of treating central sleep apnea. But if you have obstructive sleep apnea, then an ENT physician is a very integral doctor that you would need to be evaluating your airway. A sleep study is generally going to be 6, 8 to 12 hours. It just depends on how long you sleep. It starts when you go to sleep and it ends when you wake up in the morning. Home sleep studies can be ordered by your ENT physician, and in some cases they can be ordered also by a primary care physician. There are companies that contract with insurance companies to send these tests out to your home. So you do not need to necessarily go to a sleep center unless your doctor suspects that you have central sleep apnea, or if you have an underlying seizure disorder or some other sleep disorder like restless leg syndrome or nightmares or other things that they want to evaluate, more specific testing than a home sleep study. Sleep apnea is a condition where a person has sleep disordered breathing. It could be central, obstructive, or it could be mixed. Central sleep apnea would mean some kind of problem with breathing due to something going on in the brain. Obstructive sleep apnea is a blockage, and that's usually in the airway, and it can be any part of the airway. It can be the nasal airway, it can be the back of the nose, which we call the nasopharynx, it can be the lower part of the throat, which is called the hypopharynx, or it can be from something going on in the neck. And then there's mixed sleep apnea, which is a combination of both obstructive and central. So in ENT, we deal with mostly obstructive sleep apnea, and the symptoms of that are snoring, daytime sleepiness, dozing off when you are idle, like reading a book. Serious sign would be if you're sitting in traffic and you're dozing off. You could also wake up with headaches in the morning. Other medical signs of possibly having sleep apnea would be developing high blood pressure and difficulty with your heart. Sleep apnea can be caused from some kind of blockage of the airflow in your airway, and this is obstructive sleep apnea I'm talking about. If somebody gains a lot of weight and their neck gets thicker when they're sleeping at night and laying back and everything is relaxed, that weight can actually narrow the airway. It can also happen in people that have blockages in the nose, for instance, a deviated septum, or if you have nasal polyps, you wouldn't know necessarily, but if you start to snore and then develop fatigue and your partner or your family member says you're not sleeping well at night, then that may be a sign of it. You can live with untreated sleep apnea, but leaving it untreated over many years can cause numerous conditions. It can lead to reduced blood flow into your organs because you're literally not getting enough oxygen through your body. I actually have a personal family member who developed blindness in one eye as a result of ischemia, which is lack of blood flow to the optic nerve because of undiagnosed sleep apnea. If you're not treating your sleep apnea and it's very severe and your oxygen levels are going down, you could develop a heart attack. You could not wake up if you just obstruct over the night and you don't wake up because your oxygen level dips down. So it can be very, very serious in certain people. But in the more mild or moderate cases, you can develop heart failure, where you start to get swelling of your legs and fluid overload in your lungs, possibly. You can also develop something called pulmonary hypertension, which is a condition that is very difficult to treat, and it can affect your kidneys as well. Patients can definitely make lifestyle changes to improve their sleep apnea. One of the parameters that we look at in a patient who's diagnosed with sleep apnea is their BMI, which is body mass index. And if you're overweight for your height, it's very important to get into an exercise and weight loss program to lower your BMI. Some people feel that they can't exercise because they're too tired, and so it's difficult because of the sleep apnea to get into the exercise program. So a better eating plan is, going to be the first start to help lose weight. Patients with sleep apnea that is obstructive are not necessarily going to need to take any medications unless there's a component of their sleep apnea that's causing a nasal blockage that can be treated with medications. But patients with central sleep apnea sometimes do need to be on medications which stimulate their brain to wake them up frequently so that they don't keep falling asleep. If you have sleep apnea, your children are not at risk for sleep apnea. It's not a congenital disorder. The only genetic risk for sleep apnea would be body type. If you tend to have a large frame and then you would gain weight over time and your BMI would become elevated, that may be an indication. On the other side of the coin, people that have a retrognathic or weak chin, a jaw that doesn't come out to the proper configuration, that can lead to the tongue falling back. So there are some people that are not overweight, they're very thin, but they have this problem with their jaw, and that can lead to sleep apnea, and that may be something that is congenital based on body frame. There are different treatment options for obstructive sleep apnea. The gold standard has been something called a CPAP, which stands for continuous positive airway pressure. A CPAP, it comes through a machine which has a tubing that leads to kind of a mask that goes on your face. The most comfortable type of mask is one that goes just under your nose. It's called the nasal pillows, and most patients love this mask. It's very easy to adapt to, and it just pushes air in while you're breathing. With a little bit of pressure, it bypasses the blockage. And most CPAP machines are set on an auto PAP setting, which means that it will vary with the amount of pressure that it provides to the patient based on the level of obstruction. And that will vary during the night when you're sleeping based on different sleep cycles. When you're in a deeper sleep cycle, you may be more relaxed, and so you may demand more pressure from the machine. The machine will automatically sense that. When somebody has an evaluation of their airway for sleep apnea, whether it be with an ENT or an oral surgeon, one of the areas that we're looking at is the base of the tongue. And if the base of the tongue seems to be the site of obstruction, you may be a candidate for an oral appliance, which is similar to like a retainer that you put in your mouth. There's often a top and a bottom piece, and that pulls your lower jaw forward a couple of millimeters, which will be enough to open the airway. And you sleep with that at night. Snoring, the spouse, going to another room, how is that a way to live? If your partner or spouse is upset by your snoring, you definitely should get evaluated. But further than that, I think if are told you snore and then you also have these other symptoms like daytime sleepiness, fogginess at work, falling asleep when you're idle, waking up feeling like you didn't get a good night's rest even though you were in bed for 8 hours, those are reasons to get a sleep study and get evaluated.